Ever wondered what asthma is and how it affects millions of people worldwide? It's a chronic respiratory condition that's characterized by inflammation and narrowing of the airways. This often makes breathing quite difficult for those who live with it. Common triggers of asthma symptoms can range from allergens like pollen, dust mites, and pet dander, to respiratory infections and air pollution. Even tobacco smoke, exercise, cold air, and certain medications can trigger an asthma attack. It's a condition that's often unpredictable, with triggers varying from person to person. Now you might be wondering what exactly causes asthma. Well, the exact cause of asthma is not fully understood, but it's believed to result from a combination of genetic and environmental factors. Did you know there are several types of asthma? Let's explore them. First off, we have allergic asthma, triggered by allergens like pollen, dust mites, and pet dander. Then there's non-allergic asthma, triggered by factors other than allergens such as respiratory infections, cold air, and stress. Occupational asthma is another type, caused by exposure to workplace irritants or allergens like chemicals, dust, or fumes. Next, we have exercise-induced asthma, where symptoms are triggered or worsened by physical activity. Cough variant asthma is a unique type where the primary symptom is a persistent cough, often without other classic asthma symptoms like wheezing or shortness of breath. And finally, there's childhood-onset asthma, which develops in childhood and may persist into adulthood. Each type of asthma has unique triggers and requires specific management strategies. What are the symptoms of asthma and how can it be managed? Asthma symptoms can vary greatly in both frequency and severity. You might experience shortness of breath, especially during physical activity or at night. A high-pitched whistling sound or wheezing might accompany your breathing. Persistent coughing, particularly at night or in the early morning or triggered by exercise or exposure to allergens, is another common symptom. You may also feel a sense of pressure or tightness in your chest, often described as a squeezing sensation. Asthma symptoms can often lead to fatigue and trouble sleeping as your body struggles to breathe with narrowed airways. Management of asthma is a team effort, and it's crucial to work closely with your healthcare providers. Together you can develop a personalized asthma action plan. This plan typically includes identifying triggers, managing symptoms with medications such as inhalers or oral medications, and monitoring peak flow readings. Knowing when to seek emergency medical care is also a key part of this plan. Regular follow-ups with a healthcare provider and adherence to the asthma action plan are crucial for effectively managing asthma and improving quality of life. For more information, you can visit www.healthpathy.in.